Oxygen is vital for life. If you have a chronic lung disease, you may need additional oxygen for your organs to function well. One way to deliver oxygen is through oxygen cylinders. These metal tanks can be used at home or on the go. Depending on the size of your oxygen tank, you can wheel it around or carry it in a shoulder bag. Your tank size will depend on your body's needs. A larger tank holds more oxygen, and a smaller tank holds less oxygen. Some people use a conserver device to help them use less oxygen. A conserver isn't right for everyone, so talk to your doctor. Attach the regulator or conserver if you use one. Attach your nasal tube or face mask. Turn on the oxygen to your prescribed flow rate. If using a conserver, you won't feel oxygen flow until you inhale. You're all set. Oxygen is now flowing. Keep an eye on your regulator. It shows how much oxygen is left in your tank. Clean your nasal tube or face mask weekly with mild dish soap. But be sure not to get water in the tubes. Oxygen therapy can help you feel better and stay active. Getting used to your oxygen tank may take time, but with practice, your confidence and your oxygen levels will grow.